Lawmakers in Congress are now debating on new legislation that would affect monthly benefit check amounts. This can mean a benefit increase or benefit decrease. Economists have also released new details on changes for Social Security recipients and what can you guys expect in just a few days. So, soaring inflation is generally bad news for consumers, and that extends to seniors. In fact, many seniors are more likely to get hurt by rising costs of living because Social Security commonly does a poor job of keeping pace with inflation. All you have to do is take a look at this year's cost of living adjustment. Seniors on Social Security saw the benefits increase by 6% at the start of 2022, but since then, the rate of inflation has well outpaced that increase. No matter what 2023's Social Security COLA amounts to, it's fair to say that it will be notably higher than the 5.9% boost that seniors got this year. At one point, experts were saying that seniors could see a COLA as high as 11% in 2023. And so now the House Ways and Means Committee is also considering a bill that would scrape provisions under the current law that shrinks Social Security payouts for some beneficiaries with government pensions. The bill is from Representative Rodney Davis. It will get rid of two provisions that aim to prevent overly generous benefits for former public sector workers or their spouses who qualify for government pensions. But it may also be entitled to Social Security payments. And it's the windfall elimination provision. It limited Social Security for 2 million people who qualified for benefits and had a separate pension. As currently written, everybody, Davis's bill would get rid of both restrictions for benefits payable after December of this year. Because it would lead Social Security to pay out more in benefits, it would actually accelerate the timeline for when the program is expected to become insolvent by a year. So the SSA estimates that the measure would drain the Social Security Trust Fund by $146 billion over a decade, although the Congressional Budget Office has not weighed in with a formal cost estimate yet. So while the bill is widely backed on Capitol Hill, it's actually got some criticism from many Democrats. In the Committee for Responsible Federal Budget, everybody said this. A group of deficit hawks argued that in a provision, while the provisions that Davis's bill would eliminate are imperfect, they would actually get rid of them and lead to significant overpayments and weaken Social Security's finances. The group said striking the provisions would also disproportionately benefit higher income thresholds. And now Senate Republicans introduced a bill that would actually roll back the prescription pricing reforms included in the sweeping Inflation Reduction Act, including the measures allowing Medicaid to negotiate prescription prices and capping annual prescription expenses for many seniors. Republican Senator James Lankford, Mike Lee, and many others like Marco Rubio introduced the Protecting Prescription Innovation Act, saying they wanted to pull back government authority over the prices of prescription covered by Medicare. The Inflation Reduction Act was passed and signed into law in August with no Republicans voting for it, and now the bill also allows for Medicare to negotiate prescription prices for the first time in the program's history. It also placed a $2,000 out-of-pocket cap on annual prescription costs for seniors on Medicaid, as well as a $35 monthly cap for insulin. And if passed, the bill states it would make it so that the prescription pricing measures in the Inflation Reduction Act had never been enacted. Democrats who've been campaigning off of the Inflation Reduction Act have actually warned Republicans will seek to repeal the sweeping cost reduction package if they take back control of Congress. President Biden echoed these warnings earlier this week and said they're going to appeal it, the Inflation Reduction Act, if they gain more control of Congress. This means the power we just gave Medicare to negotiate prescription prices has actually gone away.
Mr. Chairman, and thank you for the peanuts. We need to energy. So, a general welcome to you and your family. To ensure the fitness of nominees for appointment to senior positions within any of the departments, I ask the following two initial questions of all nominees in any of the committees that I sit on, so I will ask you these initial questions. Since you became a legal adult, have you ever made unwanted requests for sexual favors or committed any verbal or physical harassment or assault of a sexual nature?
No.
Have you ever faced discipline or entered into a settlement related to this kind of conduct?
No.
General, over the past several years, the Regional SATCOM Support Center Pacific has experienced a significant amount of mission growth as the armed forces have become more reliant on satellite communications. Unfortunately, Regional SATCOM Support Center Pacific has not seen corresponding manpower increases to handle this additional work. With Army satellite operations set to be consolidated under Space Force in the near future, will you consider increases to the Space Force's manpower levels to ensure every unit is able to keep pace with its mission requirements?
Senator, I think one of the most important things that the Space Force has done since its inception is consolidating military SATCOM, military satellite communications, under a single service. It gives us a lot of authorities, responsibilities, and opportunities to do just what you're saying, and that's increase the readiness of those units so that they can provide these critical capabilities. And so we are redesigning currently how we assess and force present for readiness all of our units. First and foremost among those are these new units that are coming across from other services. So the short answer is, if confirmed as the CSO, I would take the readiness of these units very seriously, and the manpower element of readiness is a key concern.
That sounds like a yes. You've been asked a number of questions from both the chairman and Senator Gillibrand about the role of the National Guard and Space Force. And I recently met with members of the Hawaii Air National Guard to discuss their concerns about the potential transition of space missions away from the Air National Guard to the Space Force. And these men and women have committed to the space mission on Kauai and have dedicated their time and training to building their expertise in space electronic warfare. However, remaining assigned to the Air Force while carrying out Space Force missions has resulted in budget gaps and training delays. It is my understanding that the Space Force and Air Force are evaluating 3 potential actions to resolve this issue, including the establishment of a Space National Guard. I think that we in Congress was expecting a report on how Space Force was going to be constituted due in March, and we don't have that report yet. So until the decision...
The lawmakers, guys, in the House of Representatives and the Senate are going to guarantee a boost in benefits for Social Security beneficiaries at least. Monthly checks may be increased by at least $100 soon. Lawmakers in recent days took the first steps in ensuring that veterans actually receive a cost of living boost, everybody. That's in their federal benefits later this year, folks. And introducing legislation that would guarantee the veterans' checks see the same increase as Social Security payouts. So guys, this measure was filed by Representatives Elaine Leoria and Troy Niles. Senators John Tester and Jerry Moran have also shown their support for the bill. In joint statements, the 4 called the proposal critical to bolstering veterans' finances. The senator ranking member of the Senate VA committee said, "We have responsibility to take care of our veterans, many of whom rely on VA for financial support. As rampant inflation is driving up the cost of living, this legislation makes certain that veterans are able to keep up with our changing economy and receive the benefits they have been promised." The legislation linking the 2 government benefits is largely routine. Typical lawmakers approved the annual proposal to couple VA benefits increases with Social Security benefit increases by large bipartisan margins. But it isn't automatic. Despite efforts by some advocates in the past, an annual cost of living increase in veterans' benefits requires congressional action. Social Security benefits, on the other hand, are adjusted based on automatic formula that is triggered when lawmakers vote on it or not. Last year, as inflation pressures began to impact the economy, that increase was 5.9%. Officials have not said what this year's adjustment may be, but continued rising costs across the economy could drive that figure even bigger. The VA COLA increase legislation would apply to payouts for disability compensation and other Democratic VA assistance programs. However, much of the higher COLA could be eaten up via Medicare premium increases, which typically also rises each year. For instance, the standard cost of Medicare Part B jumped 14.5% to $170 per month in early 2022. That's an increase of $21. Seniors saw a chunk of their 2022 COLA increase gobbled up by that higher cost. What are your thoughts on this, everybody? Tell me in the comments below. For many Americans, though, the crisis-induced shutdown offered a rare opportunity to better their financial standing. Government stimulus checks and fewer opportunities for spending drove the personal savings rate to a level not seen in many years, with many consumers using the extra cash to pay down debt, primarily their debit card and credit card balances, which have the highest interest rates. Although consumers paid off a record $83 billion in credit card debt during the crisis, the recent spike in price of gas, groceries, and housing, among other necessities, is causing people to return to running up high balances on their cards. The Federal Reserve's monthly credit report found that the revolving credit, which mostly includes credit card balances, jumped 20% in April from the previous month. Meanwhile, credit card balances are also up year over year, reaching $840 billion in the first 3 months of 2022. and are expected to keep heading up higher. The rise in credit card borrowing, together with auto loans, student debt, and mortgages, has now propelled total household debt to a record of $15 trillion. The downside for consumers is that credit cards are one of the most expensive ways to borrow money.
Median price for new brand name prescription drugs. In other words, about half of all new brand name prescription drugs approved by the FDA are beyond the imagination of what normal, ordinary income people can pay. Now, how does this happen? And this gets to a very important point that we don't discuss, I think, enough either here as well. And that is that maybe this reality of the pharmaceutical industry charging outrageous prices and getting approved by the FDA has something to do with the fact that 73% of the FDA's budget to regulate the pharmaceutical industry comes not from the taxpayers who want lower cost prescription drugs, but from the industry itself. All right, so the industry, in a sense, is regulating itself. May make sense to somebody, not to me. Madam Chair, we should be clear, sometimes we forget about this, that the mission of the FDA, and let me quote it exactly, quote, FDA is responsible for advancing the public health by helping to speed innovations that make medical products more effective, safer, and more affordable. That is one of the missions of the FDA. And yet, whether it is a Democratic nominee for the FDA commissioner or a Republican, we really do not see that as a particularly high priority. To correct these fundamental problems, I have filed 4 amendments, which I would like to bring up for a vote, Sanders 1, 2, 3, and 4, to this bill. The first amendment that I filed would allow wholesalers, pharmacists, and patients to purchase safe and affordable prescription drugs from Canada and the United Kingdom. After a 2-year period, the FDA would be authorized